Mary. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Joseph Mealy. We are talking about breast enhancements, augmentation, lifts, all that. And I want to give you the phone number if you need to call in. It's 415-561-8753. Again, we're going to be posting the doctor's number as well, so get ready to jot that down if you need to. All right, we have a phone call, doctor. It is Monica from Fremont. Hi, Monica. Can you hear me?
Yes, I can.
Monica, ask the doctor a question.
Okay, so I had a breast abscess right now.
Okay.
And they're going to be doing plastic surgery to put an implant in there. My question to you, will my breast still look normal after this is complete?
Yeah, it's two separate issues. With an abscess, if you have an infection in the breast, that should be treated first. So that needs to be drained with antibiotics and sometimes even need surgery in order to clean that out. Once that is cleared up, then it would be safe to put the implant in. Putting a breast implant in during with an infected breast, probably not a great idea because there's a chance you may get infection around the implant, and then to clear that up, the implant needs to be removed. So once that's cleared up, then you get an idea what the breast shape looks like. You want to discuss that with your surgeon and ask them, what's going to happen to the shape. The implants tend to increase the whole size of the breast rather than selectively increase one area of the breast. So if there's an indentation, if the implant's large enough percentage-wise, it'll tend to smooth that out. But if there's an indentation and the implant's not going to be big enough to smooth it out, there are other techniques that can selectively increase parts of the breast, like fat grafting, but again, it needs to be done after all the infection's cleared up.
Does that answer your question, Monica?
Yes, it does.
And Monica,
thank you.
I mean, you said you were getting augmentation. I'm just wondering, what is your reason? Women have a lot of different reasons. What's yours?
Well, mine's just a little, I hate to say this, deformed because I've had so many aspirations because of the breast abscess.
Gotcha.
Sure.
That's common, is it not?
Well, if there's an abscess, a lot of times you have to remove some of the breast tissue to get it to clear up, so it can cause changes in shape.
All right, Monica, I hope we answered your question. Thank you for calling.
Thanks for calling.
If you would like to call, give us a call, 415-561-8753. All right, let's talk breast lifts now.
Sure.
Who's your candidate for a breast lift?
So breast lift, the ideal candidate has breasts the size they want to be, but the shape isn't right. Either there's too much skin and it's dropped down, or there's a congenital deformity like a tubular breast or an asymmetry in the breast that we're trying to correct. So both those work very well. There are different types of lifts depending on what we're trying to correct.
Right.
Sometimes women just have sort of a puffy nipple where that area is filled, but the rest of the breast is okay, and we'll use a very small lift around the areola to reduce that.
That's interesting.
Other times the whole breast is low, and then we'll use the sort of the traditional inverted T type of incision, and there's everything in between. We're always trying to eliminate as much scar as we can.
Is it common if a woman goes in for a breast lift that she also wants an augmentation? She wants an implant put in?
If the size is too small, then yeah.
Okay.
Yeah, but if the size is right, then you don't have to deal with the problems of having an implant in there. Sometimes it's better not to.
What about recovery time on the lift?
Recovery for lifts, again, if it's just a lift, pretty quick.
Good.
We don't have the stretching that we have with the implant. We're not making things bigger.
Yeah.
And we're just lifting everything up.
Excellent. Are there any new procedures for lifts out now? Probably not.
Well, with lifts, the incisions and such, people have been working on it for a long time to try and minimize it. So the most important thing is to sort of personalize the operation so it does what we need to do without doing things we don't need to do. And the other thing is there are some newer techniques to internally lift the breast. So a lot of times we'll use the patient's own dermis because there's plenty there, but if it's insufficient, sometimes we'll use a cellular dermal matrix, which is a fancy word for cadaver skin. Or there are some implantable meshes that are starting to come out.
All right, let's go to before and after pictures for breast lift. Here's our first one.
So here's a lift. So this is someone where we've just lifted up the breast. The volume has not changed. I did reduce the right side a little bit more than the left to make things even, which is very common. Usually one breast is bigger than the other. And you can see that we can add fullness both underneath the nipple and up a little bit higher. But again, with the longer breast, a little implant at the very top may add a little bit more volume in that area. I usually show people before and after pictures, and if they're happy with that, then we don't need to.
Here's number two.
Same idea here. So we've added...
a lot of fullness.
This might be an augmentation lift, I'm thinking. I did use an implant in this case.
Good,
because there is more volume, both on the upper pole and lower part. You can see between the breast, the lower part of the cleavage, the breast sort of diverged. And I needed to add some volume in there to help with the shape in that area also.
Now, interesting on this picture, I don't see any scars at all. Here's another picture too. But I mean, the scars are very minimal on these photos.
It depends on the patient. I mean, some people get pretty bad scars, but that's 1% of the time. So a small percentage of the time.
And they will fade.
And they fade with time.
And what
on
about
the
this
previous
picture?
one, there was no vertical or horizontal scar because with the augmentation, adding the volume helps to support the breast, so there's just an incision around the areola. In this case, there's an incision around the areola down and across the bottom because there's so much extra skin there, it needs to be removed. And really, that's what the scar is doing. It's not lifting, it's removing extra skin and kind of pushing everything back up.
Okay, that's very nice. And what about combining the lifts with other, do a lot of women come in and, you know, say, I need the lift with the aug, with the tummy tuck, everything
the
combined?
most common combination with breast lifts is breast augmentation. So we're doing what we call a mastopexy aug, or breast lift with augmentation. But again, if it's someone who's had children or lost weight, especially patients who are post-bariatric surgery, they may want a body lift, breast lift, arm lift, thigh lift, depends on what area has gotten loose.
Gotcha. And can you do all those together?
Usually we try and stage it.
Oh, you do? Okay.
Yeah, I mean, I like to do what I need to do, but I want to make sure people are around to enjoy it. So, got to be safe.
Okay, absolutely.
So it needs to be under the right circumstances with the right anesthesia and the right equipment around.
All right. For more information, call Dr. Mealy, 925-943-6353. Check him out on the web at either drmealy.com or sanfranciscobreast.com. We'll be right back on Body Beautiful.